had a patient interaction earlier today that reminded me of a video that I've been wanting to make for a while. And that's if you've had an acute vestibular loss, then be careful about getting hard massage or hard manual therapy done to your neck in the time period after you've had this acute loss. Acute vestibular loss is caused by viral infections in the inner ear, which causes damage to the vestibular nerve, which often leaves people feeling an intense feeling of vertigo for hours, and it can leave people feeling dizzy and off balance for usually about 7 to 10 days after the acute vestibular attack. As patients gradually get their balance and equilibrium back, they may actually feel a sense of tightness inside of their neck, and it feels like they have this chronic neck stiffness that just kind of won't go away. And as a result, they usually go to a chiropractor or massage therapist to start to work on some of these tight neck muscles to try to get it to loosen up. The problem is when you've had an acute vestibular nerve lesion like that, one of the compensations of acute vertigo is to actually tighten up your neck because your brain doesn't want your head to move around too much, so it starts to create tightness in the neck as a way to compensate for that acute vestibular loss. If you work on these neck muscles too much, you may actually decompensate that patient. They may actually feel a lot more dizzy after the fact. In these subset of patients, don't expect it to be a cervicogenic dizziness problem. Expect it to be an acute vestibular loss, and they probably need vestibular rehabilitation.